The member from Lambton-Kent-Middlesex.
My question is for the Minister of Health. Speaker, by now the minister should be aware of the heartbreaking and tragic situation in Windsor of the death of Jamie Lynn Ingham. Jamie was a 6-year-old girl who died while waiting for Ornge Air Ambulance to respond. While Jamie Lynn's family waited frantically for an Ornge Air Ambulance to transport Jamie to London for emergency surgery, we now know Ornge Air Ambulance was never even dispatched. After a 3-hour delay, doctors at Windsor Hospital were shocked when Ornge's medical transport team arrived from London in a taxi. Dumbfounded after losing 3 crucial hours that could have saved Jamie's life, doctors had no choice but to send Jamie Lynn to Detroit via municipal land ambulance, where she sadly died. Minister, are you prepared to look the Ingham family in the eye and repeat your spin lines that Ornge is a world-class service and that your decisive action is working?
Minister of Health.
Speaker, as I have said, every case is a human tragedy. Every case has a family, Speaker, that is grieving.
The member from Northumberland-Quinte will come to order. Second time.
We owe them, Speaker, the answers to their questions. We owe them an answer. We owe them the truth, Speaker. I am not qualified. The member opposite is not qualified to give the answer to that family.
It is regrettable that we have to get into personalizing this towards each other. Minister.
Speaker, I rely on people who have no partisan interest, who are not looking for political gain. I rely, Speaker, on the Chief Coroner of the Province of Ontario to use his professional judgment to determine what the cause of death is, Speaker.
The member from Northumberland-Quinte West is now warned. Finish. 10 seconds.
Speaker, we have a process in place. The process is working. I urge the member opposite not to use tragedy for political gain.
Supplementary.
Well, Speaker, in the minister's own words, she isn't qualified. I honestly do not know how the minister can sleep at night. Speaker, it's clear the minister's failure to oversee Ornge has left Ontario's air ambulance service in shambles. It's unconscionable to think that critical care air ambulance paramedics are taking taxis to respond to life and death situations. This would be laughable if only the consequences were not so serious and tragic. The minister not only owes the Ingham family an apology or an explanation, but she does owe some words for her failures. So I ask her, now that we know of the death of a child on her watch due to Ornge's inability to respond, and since she refuses to listen to frontline emergency workers or our party, will she now at least listen to the CEO of Windsor Regional Hospital? Will she admit that she owes an apology to the family? And will she write to the coroner under her signature and ask for a coroner's inquest into Jamie Lynn's untimely death?
Be seated, please. Be seated, please. Thank you. Minister of Health.
Speaker, the coroner of this province of Ontario, the chief coroner of the province of Ontario, is informed of every single case that the ministry is required by law to inform him of, Speaker. We inform the coroner. The coroner collects all of the facts. I challenge the member opposite. He cannot possibly know all of the facts. Mr. Muji, the CEO of Windsor Regional Hospital, has written to the coroner, has requested more information. That is exactly the process that should be followed, Speaker. This is not a political debate. This is not about political gain. This is about human lives, Speaker, and working to make the system stronger.
Thank you. New question. Member from Bramalea.